Okay, so um, this is going to be the flow of our presentation for today. Um, it's got four main parts. Firstly, we're going to start with what are the Ministry of Health policies right now during the COVID pandemic. There have been changes that were made to policies with regards to OHIP, and we're going to go through that. Second part is what to do if you are sick, whether you think it's COVID related or not. Number three, scenarios. You know, when you go and get yourself checked or if you inquire with healthcare providers, what if, you know, because number one is what should be, but as we know, things don't always play out the way they should. So we're going to go through some commonly expected scenarios during the third part. And then number four is what advocacy efforts are happening right now in terms of migrants and making healthcare accessible for migrants. And then we'll open it up to questions, but also if there's anybody in the, if there are any participants who also have, you know, knowledge to share, we welcome that. Okay, so it's three main things, three main changes that the Ministry of Health has made with regards to health coverage during this time. The first one is expanded health coverage for patients without OHIP. You know, this workshop is geared towards migrants, and this is one, I think, very common concern among migrants is what if they don't have OHIP? So the Ontario Ministry of Health has expanded healthcare coverage for patients without OHIP during the outbreak. As of March 20th, the Ministry of Health has directed all hospitals to provide all medically necessary services to anybody who goes to the hospital, whether or not the person is able to present a valid OHIP card, or whether or not they have any other kind of um, you know, insurance. And that includes not just COVID-related health services, but any other hospital services that are needed. So it means that patients who, you know, come to the hospital without OHIP should not be asked for payment on the spot or even after you receive treatment. If you receive treatment during the time of the COVID pandemic, you should not receive any bills for hospital care. Right? So that is for patients without OHIP. And also, there is actually a bulletin. There's a bulletin that was sent to hospitals and physicians that says services for people without insurance should be, you know, they should be given as much importance as services for people who have insurance. And this is in accordance with the fact that we are in a crisis situation, and the utmost concern should be, you know, addressing and ensuring the health and safety of all people in Ontario, for us particularly. So they should be making sure that everybody gets the health services that are needed. So in terms of information that is required from people going to the hospital, the Ministry of Health only requires hospitals to record the following information: patient name, gender, and age. So technically, this means you don't need to present an ID because you know, they can simply ask you for this information: give your name, your gender, and age. And so that's all they should be asking you. If they ask you anything else, you are not obligated to give any of that information. So that's for hospitals, and that was as of March 20th. As of March 25th, all Ontario physicians, including those who don't work in hospitals, so those with their own clinics, have also been directed to serve patients who approach them without any OHIP coverage. And these bulletins that were sent out to physicians outlined all the information about how the physicians are going to be paid, how they're going to be compensated by the province. So the province is right now shouldering the cost of healthcare for people without insurance. Um, and they do have those specific instructions. So it may not be widely practiced yet, but that is how it should be. Later on in this presentation, we'll go through, what to do if for example, you come across a healthcare provider who doesn't seem to be aware of this policy. Um, so those are the the changes for people who don't have OHIP. So right now, they should, if you don't have OHIP, you should be able to get services from the hospital or from a doctor's office. For people who are eligible for OHIP, and so these are, permanent residents, people with valid work permits. Um, normally there's a 3-month wait time for OHIP. If you, for example, have just moved into Ontario, you need to wait 3 months. Like when you send in your OHIP application, there's 3 months before you can get it. Um, right now, that 3-month waiting period for OHIP has been removed for everyone who is able to apply for OHIP. So from the Ministry of Health website, if, for example, you've already put in your OHIP application before March 19 of this year, but you're still waiting because you're still within that 3-month waiting period, then because of the changes, you are covered by OHIP, even though you're supposed to be on the waiting period. You are covered now. So there's a phone number, the Service Ontario info line. It's here on the screen, 1-866-532-3161, to have your OHIP effective date adjusted in the records of the ministry, and for them to issue a health card to you immediately. Of course, this is something that you would do. You can do this right now if you're in this situation. And if you are well, right? If you're well enough to do this, please go ahead, by all means, do it. But of course, if you're already sick, you don't have to go through this whole process. Just, um, contact telehealth. We'll go through what you need to do. Also take the necessary actions to get your health concern addressed. You don't need to call telehealth and go through all these processes if you're already feeling ill. And the second one, if you're self-isolating, say you're eligible for OHIP, but you're already sick, you're self-isolating, and you can go to Service Ontario. If you are well enough, if you're not terribly sick, but you're self-isolating just to be safe, you can call the Service Ontario info line at 1-866-532-3161. So you will get instructions on how to expedite your or how to get your OHIP coverage to take effect immediately. So this is for people who are eligible for OHIP. And the third situation is for people who already had OHIP, but their OHIP cards are expired or about to expire. So right now, the Ministry of Health is saying that all OHIP cards are expired. OHIP cards are still currently effective. If you have an expired or soon to expire OHIP card, they are effective until further notice. So because we're in a health crisis situation, this is this is a measure that the government has taken. So those are the three main changes in terms of um, uh, OHIP coverage and being able, access to health services. So now we go into the no, before we go into the next one, these are the additional no-cost options that are available for people who are uninsured. There are walk-in clinics in Toronto who will see people who are uninsured. You can look for that list at this website, or you can also contact us at MRCC and we can give you a copy. But just to show you, um, So that's the website. If you wanted to look for it yourselves, that's the website you would go to. And right here, if you open that, there. So you get the list of medical clinics. And depending on where you're located, you can you can find the clinic that is closest to you. So these are medical clinics in the GTA for uninsured clients. And you'll also see there's specifications for each clinic of people they are able to serve and not serve. Like, for example, the first one, the West End non-insured walk-in clinic, says they don't serve people with visitor visas or student visas, but all other uninsured persons they will serve. So this is a good resource for people to consult if you are looking for a no-cost walk-in clinic. So, and then other no-cost options, COVID-19 assessment centers should be accessible without OHIP. Telehealth Ontario is open to everyone. It's a phone line that you can call if you have symptoms. That's the phone line you'd call if you have symptoms. And then Toronto Public Health is also a phone line, but this is not necessarily for people who are feeling sick. It's for general questions about COVID-19. So these are free, resources if you wanted to get more information or if you wanted to get any health services. So the second part is, now this is what to do if you're already sick. There you have three options. If you wanted to just find out for yourself, and this is pretty easy if you have a cell phone, right? If you have internet access, you open the COVID-19 self-assessment tool on on the Government of Ontario website. You can call Telehealth Ontario at 1-866-797-0000. Although because of the situation now, some people have found it difficult to get through the line. You may have to wait. There's an option to, I think, to wait on the line or indicate that it's okay for them to call you back. And it's all automated at first when you first dial in. But if you do choose the option for somebody to call you back, you will get a call back from from a nurse. The third option is if you have a primary healthcare provider, if you already have a doctor, then you call your doctor. It may be easier that way. So just to show you what the COVID-19 self-assessment tool looks like, if you go to that website, this is what it is. So there's a button at the bottom of the screen that says start self-assessment, and we can just go through this and see what happens. If you experience any of these issues, for example, and it lists the health issues there: severe difficulty breathing, severe chest pain, feeling confused or unsure of where you are, or losing consciousness. For example, you're experiencing any one or more than one of these symptoms, you click yes. It tells you right away, call 911 or go directly to your nearest emergency department. Or we can try in the situation that you say you're not feeling any of those symptoms. You click no, and then it gives you another set of symptoms. If you feel any of those, even, for example, you're feeling something which you may not necessarily think is related to COVID, say pink eye. It's there. You click on it, and then it tells you contact a doctor or telehealth, and it tells you how to how to take care of yourself. So that's I find that's the most useful tool if you're able to access it. Now, if you have to go to an assessment center, you can also, if you can, people who are experiencing these symptoms will be directed to visit an assessment center, right? And all this information is in the City of Toronto website if you want to look at it. But just the list of assessment centers in the GTA is also there. But just to show you, just to give you an idea, I grouped it by geographic location in Toronto. In Etobicoke, there's one assessment center in the Etobicoke General Hospital. If you're in North York, you have three options depending on what's closest to you. Humber River, North York General Hospital, Sunnybrook Health Sciences Center. Downtown, there's Mount Sinai, St. Michael's Hospital, or the Women's College Hospital. And you'll see that there are age restrictions indicated. So if you need to go to an assessment center and you have a child, that's something you would want to look at also. And if the nearest assessment center to you does not allow, if your child is not going to be allowed there, you may have to arrange for childcare. And I know this is a very difficult, an additional obstacle. So it's either you arrange childcare or you go to, find the next nearest hospital that will allow you to bring your child if you really must, if you don't have any childcare options. So West End, there's the Toronto Western Hospital and St. Joseph's Health Center. East End, there's Michael Garron Hospital. In Scarborough, there is the Birchmount Hospital and the Centenary Hospital. And again, these are on the City of Toronto website. If it's easier, you can just contact us and we'll give you all these, contact lists of clinics that you can, clinics and assessment centers that you can visit. So that's it for, if you're sick, there's online tools, there's Telehealth Ontario, and if you have a doctor, then you can contact your doctor. Now, those are ideally if healthcare providers are following the policy, if everybody's informed and if everybody is, understanding of the current situation, especially as it applies to migrants, everything should go smoothly. But we know that in real life, that's not often the case. So these are just, we try to brainstorm some concerns that might come up. For example, if you're feeling sick and you have to go to the hospital or assessment center or doctor's office, and you don't have OHIP or any insurance, what do you say when you go there? You should be able to just, say that you're feeling sick and you don't have OHIP. And then the next one, what if they ask you why you don't have OHIP? If you feel comfortable telling them, depending on your situation, right? You can say, I'm at my 3-month waiting period. I don't have the card yet. They should know that. And if they don't, you can state, what you learned here today, like you can say, as of now, as far as I know, doctors, physicians in hospitals are supposed to provide service to people who are, in their 3-month waiting period. But, if you're in a more precarious situation, you really shouldn't have to reveal any details about your status, about your immigration status. If that's the reason why you don't have OHIP, you're not obligated to tell them the details of, your situation. So if they refuse to serve you because you don't have OHIP, even if you, try to talk to them, your options would be to call somebody who will be able to advocate for you. One option is community legal clinics in the Toronto area. So you'll find a list of legal clinics in this link. I'm not going to open it right now, but there is, you can find legal clinic directories online. And I know there are legal clinics in neighborhoods across Toronto, North York, East End, pretty much the same like with the assessment centers and the um, and the walk-in clinics. So legal clinics are, there's several across Toronto. Or you can call us at our hotline 1-866-275-4046, and there is somebody will answer you if you call our hotline. The MRCC staff are all connected to that hotline, so we can answer if you have urgent questions. um, but the important thing I just want to stress if you get pressured to reveal why you don't have OHIP, and if there are questions alluding to your status, you don't have to reveal that to anybody. You don't have to say that. You don't have to answer those questions. So that's it for now. Jason, did you want to add anything to that particular portion?
No, I think that we've covered a few things, and perhaps as far as particular questions, they can be raised later when we open up the Q&A if there are others who have specific questions. But yes, like what Miti said, this is supposed to be what it should be when you go to clinics and healthcare providers. But given that sometimes things don't normally run as smoothly, please we encourage you to contact our phone number, our hotline, and we're able to assist you whether we advocate on your behalf or help translate things on your behalf. So then that's staffed by our volunteer, the phone line that Miti had just mentioned.
So we've gone through what the current policy is, what to do if you're sick, and some scenarios or of obstacles you may encounter. So with us, with MRCC, always recognizing that there's more work to be done in terms of making the situation better for migrant workers. We also want you to know that we there are efforts, and MRCC is part of efforts to continuously advocate for better and more accessible healthcare to migrant workers. And anybody regardless of their status. So I am gonna at this point turn it over to Jason to discuss those advocacy efforts.
Thank you, Miti. So as far as our MRCC's work is concerned around advocacy, as Miti mentioned, we know that the things that are the policies and things that are being given and that are being extended to everybody is really a result of the advocacy work that MRCC and all the other migrant groups and worker groups have been doing since COVID struck. So we acknowledge the importance of advocacy work. So as far as MRCC is concerned, we are part of a migrants network, a national migrants network called the Migrants' Rights Network, which has been advocating for universal access to CERB, but also healthcare for all. So what I'll do is I will share my screen if that's possible. Okay, so as I said, MRCC is part of a national network of migrant organizations that have laid out very clearly what are the important things that should be done both by the federal government, by the provincial government, and even at the municipal level. And that there's 5 points. First is that healthcare coverage must be comprehensive. It must covering all medically necessary services and does not make it artificial or harmful for workers. Number two is all healthcare institutions are informed of the policy details and how they will be implemented, including coverage changes, application of billing codes, sharing personal health information, and collaborating with other agencies such as the Canadian Border Service agencies. We understand and we believe that during this time, the least of the concern of workers should be their the most important thing that we should be looking at is the health situation of each worker, and they shouldn't be worried about their status being shared to different agencies that don't necessarily need to be shared to. So we believe that there should be privacy in that regard. An explicit public messaging campaign informing all uninsured communities to the broader public that all healthcare services are available at no charge, regardless of immigration status. And as we can see, since these demands have been laid out, there has been slowly some realization as far as these demands. Number four is that CBSA guarantees that accessing healthcare will not result into detention and deportation, and this is specific to workers, to migrant workers who may be of a precarious status. Again, during this time, it is their health that must be put into the forefront, and not necessarily whether or not they have immigration status. And number five, health coverage is permanent and carrying beyond COVID-19 pandemic as a human right and public health measure. And we believe, obviously, that health is a human right, and it isn't only during the COVID-19 pandemic that we should be stepping up, or government and institutions should be stepping up, but this should happen beyond. Part of the overarching campaign calls that MRCC is a part of are have come up with these calls. Number one is healthcare for all. So even in a pandemic, many people are excluded from basic healthcare. All levels of government must ensure access without fear, regardless of immigration, to free, universal, and expanded healthcare. So that goes without saying that healthcare is a human right for everybody, and that everybody should be included, including folks who may not have valid status, immigration status. The other overarching call is worker protections, particularly to migrant workers who are in cramped spaces, working spaces, and workers who may be living with other migrant workers who in a substandard living condition. We are part of the network calling for better housing for all migrant workers. We are also calling that uh, migrant workers and undocumented workers, if do get paid sick leave, if they do get sick. And lastly, and one of the things that's been an issue for a long time is a strong anti-reprisal protection for migrant workers. We know that many workers are obviously, as the program is set up, their immigration is tied to their employers, their immigration status. So there's always the fear of losing your immigration status if you do try to assert your labor rights. So we also we're part of a network calling to ensure that if a migrant worker decides to speak up, they shouldn't lose, or their immigration status shouldn't be jeopardized. And lastly, which is the fundamental flaw of many of the temporary foreign worker program, is the fact that you know workers come here temporarily, and a lot of the issue starts from the fact that they are second class citizens. So we believe that status for all is important, and even more imperative now, the fact that during the COVID-19 pandemic, and for those who are already here, we're calling for open work permits and an extension. For those who are about to lose their open work permit, and this is to ensure that nobody fall out of status during the COVID-19 pandemic. And lastly, it's we call on everybody to come together, regardless of sector, regardless of your status, to support one another. And this is one of the things that we're doing with MRCC. We've since COVID-19 pandemic hit, uh, we've adjusted the way we've been working, but nevertheless, we continue to do our work. That's why our phone line is continuing to be supervised by all the staff. We continue to do our work as far as doing these online workshops, and we understand that there is a lot of xenophobia and racism that's coming out of this narrative, given that this pandemic has hit a lot of people. So we call on our community to support one another, and if you are in the position to help, we are calling to everybody to help out. And lastly, before we move on to the question and answer portion, there is also a uh, a network, and this was shown by Mickey earlier, the healthcare network for uninsured clients, who have laid out some calls to our community, and this is specific to healthcare providers, and I'll just read them through. Number one is to remove the payments and payment sign and forms that can be deterrent to seeking care for uninsured clients. Number two is the use of interpretation services when needed. Number three is, as per March 20, the Ministry Directive Emergency Department should provide uninsured patients and care offered to uninsured patients. This include registration, triage, and treatment. So more or less, it's the same call that many migrant organizations have asked for as far as health is concerned. So we, as MRC, have also signed on to the letter that the healthcare network for uninsured clients have provided out in the community.
Feel free to reach out and connect with us. And even if it's not about anything specific, but you wanted to just have somebody to talk to, or you need a sense of community during this time, we encourage you to reach out to MRC, because now is more than ever is the time that we need each other, right? So I just wanted to share that too before we end our conversation.